Hello, wonderful students. Myself, Dr. Maddineni Srinivas, your dermatology faculty from Bharat. So, in this video, we're going to cover the pseudo conditions which can be seen in dermatology. Let us begin our discussion with pseudo Chancre Redux. So, first, you should know what is Chancre Redux. I hope all of you know Chancre, or we call it as hard Chancre, is classically associated with the primary syphilis, and Redux means to come back. So simply put, I will give you a case scenario. A patient with primary syphilis is treated with injection than penicillin, after which the lesion healed. Now again there is a reinfection with the Treponema pallidum, which is causing the primary syphilitic lesion to reoccur at the previously healed Chancre site. So this is what is referred to as Chancre redux, recurrence of a syphilitic Chancre at the original previous site of a Chancre site. So this is Chancre redux. So what is pseudo Chancre redux? Very simple. If at this previously healed Chancre site there is development of a gummatous lesion, which is classically seen in tertiary syphilis, this is what is called as pseudo Chancre redux. Okay, I hope it is very much clear. So now let us see what is Bubo and what is a pseudo Bubo. So remember, Bubo is nothing but a inguinal lymphadenopathy, which is true inguinal lymphadenopathy, and it is classically seen in the chancroid and LGV. Whereas pseudobubo refers to a subcutaneous soft tissue swelling at the inguinal lymph node area. It is not a lymphadenopathy, and this is classically seen in the case of donovanosis, which is also called as granuloma inguinal. My question for all of you: what are the causative agents for all these three diseases? Can you name them? Put your answer in the comment section. There is one more entity called as pseudo groove sign. First, you should know what is a groove sign. So, in again the LGV, we are going to see this groove sign in which the inguinal lymphadenopathy and also the femoral lymph node enlargement, both of them will give rise to a groove due to the inguinal ligament, which is not going to yield. So this is the groove sign which you are able to see, where you are able to see that there is some groove appearing. This is classically seen in LGP, whereas in the case of the pseudo groove sign, just remember we are going to see this again in the donovanosis, which is also called as granuloma inguinal. Basically, here a groove-like appearance will happen without a true lymphadenopathy, because I hope all of you do remember now here pseudo bubo is seen in donovanosis, which is granuloma inguinal. So that is the reason why we are going to see a pseudo groove sign in this condition. Next is the elephantiasis and the pseudo elephantiasis. Again, the simple funda. Elephantiasis we are going to see in filariasis. I hope you have learned it in your microbiology. It's the most common cause, but even LGV is also associated with the genital elephantiasis. This is because of the true lymphatic obstruction leading to progressive swelling of the genital area. Whereas in pseudo elephantiasis, which is seen in the donovanosis, so remember there is going to be localized swelling of the genitalia instead of the involvement of the lymph nodes or lymphatic obstruction. So this is referred to as pseudo elephantiasis. And here you are able to see in this picture the picture of a patient having genital elephantiasis. So next is a vesicle and pseudovesicle. I hope all of you know vesicle is a clear fluid filled lesion which is less than 0.5 centimeter in size, and it is classically seen in the viral infection herpes simplex, herpes zoster, and also varicella chickenpox. Pseudovesicle is a term used in the case of sweet syndrome, which is a very important neutrophilic dermatosis. That is, they are going to be collection of the neutrophils in the dermis, and here the lesion is going to resemble a vesicle, but there will not be any fluid inside this. Okay, so here you are able to see these are the small vesicles, fluid filled areas, and this is a patient of the sweet syndrome where you can see that it is appearing like fluid is present, pseudo vesicles. Next is Nikolsky sign and pseudo Nikolsky sign. Very, very important. So on application of the pressure, tangential pressure on the skin, what will happen? There is going to be detachment due to the underlying acantholysis in the case of the Nikolsky sign, and this is very classically seen in the conditions like pemphigus vulgaris, pemphigus foliaceus, and staphylococcal scarlet skin syndrome. Now, what is the pseudo-Nikolsky sign? Here, there is going to be again a peeling off of the superficial layers of the skin, that is epidermis, from the underlying dermis. But the underlying reason here is not acantholysis, but here it is necrosis of the keratinocytes. And it is very classically seen in the case of Stevens-Johnson syndrome and toxic epidermal necrolysis. So here you are able to see this is a Nikolsky sign, peeling off of the superficial layers of the epidermis from the underlying dermis. And in fact, I have made a very detailed flashcard on the signs, so you can check out. The link is present in the description. Next is the Darier sign and pseudo-Darier sign. So remember, there's one condition called as urticaria pigmentosa, which is a cutaneous mastocytosis, in which children are going to present with hyperpigmented lesions over the trunk. Basically, these are due to the mast cell proliferation occurring in the skin. So if we give a small stroke with a blunt end of the pen or pencil, what will happen? There's going to be degranulation, releasing the histamine, because of which there's going to be urticarial lesion developing. Urticarial lesion developing. That is wheals and erythema at the site of wherever we have given the small stroke. So this is what is referred to as the Darier sign, whereas in the case of the pseudo-Darier sign, remember, there is not going to be any mast cell degranulation, no histamine release, nothing. Here, because of the congenital smooth muscle hamartoma, there is going to be a minimal response in the form of the skin elevation. Mild skin elevation is going to occur. Slightly the skin is going to become taut, and it will appear different from the rest of the skin wherever we have not given a stroke. So this is what is referred to as pseudo-Darier sign, and it is classically seen in the congenital smooth muscle hamartoma. Basically, it is because of the piloerection that we are going to see the pseudo-Darier sign. Okay, next is the Koebner's and the pseudo-Koebner's phenomenon. I hope you all know already. The Koebner's phenomenon, it is classically seen in the conditions where there is underlying autoimmunity, like for example, psoriasis, lichen planus, and vitiligo. There is going to be development of similar appearing lesions at the site of the trauma. As you are able to see here, this is a patient of lichen planus. You are able to see along the scratch marks, this is development of the lichen planus. Now coming to the pseudo-Koebner's phenomenon, very simple. So because of the auto-inoculation of the viral particles, in the case of the viral warts, it is human papillomavirus, and in the case of molluscum contagiosum, it is molluscum contagiosum virus, which is a pox virus. So there's going to be auto-inoculation and development of these similar looking lesions along the lines of the trauma. So this is what is referred to as pseudo-Koebner's phenomenon. Okay. So I hope all of you have enjoyed this video, and if so, please do hit that like button. Also do subscribe to this channel, and you can write in the comment section if you have any queries related to this. Share this among your friends who are having doubts related to dermatology. Thank you so much. Happy learning. Bye bye.